bactericidal antibiotic from a bacteriostatic one. ঠিক আছে? Third one is Levodopa Carbidopa. Question comes, why is Levodopa and Carbidopa used together? Well, so Levodopa is used in Parkinson's disease. In Parkinson's disease, substantia nigra produces less amount of dopamine. Levodopa is a precursor of dopamine. It is converted into dopamine by a enzyme dopa decarboxylase. ঠিক আছে? So dopa decarboxylase is present all over the body, but we are using levodopa to increase the dopamine concentration within the brain. Dopamine cannot permeate the blood-brain barrier. It cannot permeate the blood-brain barrier, but levodopa can. ঠিক আছে? So carbidopa, what carbidopa does? Carbidopa is a inhibitor of dopa decarboxylase. তাহলে কি হবে? There will be no peripheral conversion of levodopa to dopamine. So the concentration of dopamine in the brain will be increased. ঠিক আছে? The dopamine peripheral dopamine causes plenty of adverse effect. হাইপারটেনশন হবে, ঠিক আছে, ভমিটিং হতে পারে। আচ্ছা, can any drug be combined with any drug, anything? No. First of all, the half life has to be compatible. ঠিক আছে? তাই অ্যামক্সিসিলিনের হাফ লাইফ হচ্ছে প্রায় 1.5 আওয়ার। So is clavulanic acid 1.5 hour. Trimethoprim is about 10 hour. Sulfamethoxazole is about 11 hour. ঠিক আছে? So the half life of both the drug must be compatible. ঠিক আছে? কাছাকাছি থাকতে হবে। And volume of distribution must be same না হলেও হয়, there must be compatible. The amount of drug in the fixed dose combination, that depends on the volume of distribution and on the peak plasma concentration. ঠিক আছে? Same, it may not be same, volume of distribution may not be same. ঠিক আছে?